Welcome to Tuesday's edition of COVID-19. Korea has recorded 386 cases today, and tomorrow we mark exactly a year since our first infection. Accordingly, our lineup for this week includes stories that share diverse aspects of the pandemic over the past year. But first, here is our Kwon So-ah with the pandemic updates. So do start us off with the latest here on the domestic front.
All right, Sunny. Tuesday's caseload was pretty similar to Monday's, which means we are in the 300s for the second straight day. And also domestically transmitted infections dropped to the mid-300s with a slight rise in imported cases. And that raises the total number of infections here in Korea to 73,115 with a double-digit figure of fatalities, with the death toll now at 1,283, and also the death rate as of recent stands at 1.75%. Now, since last Tuesday, we had infections in the 500s for 6 straight days, and now we are down to the 300s. We will have to monitor the situation throughout the week, but for now it looks like a downward trend. Now, recent analyses of COVID-19 trends here in the nation show that there has been a rise in transmissions among families, friends, and colleagues, while cluster infections have actually been going down. So that's why authorities are stressing extra caution when interacting with those who are near you. And especially as the infections are still scattered across the nation, today not being an exception. We still have triple digits in the capital, Seoul and Gyeonggi-do province. But here in Seoul, the number of domestically transmitted cases has actually dropped to the double digits this Tuesday. And also, although we have many single-digit figures, the total accumulated cases in Ulsan has hit 900 and also Jeju-do Island 500. We also have a variety of cases from abroad this Tuesday, with 16 infections from the U.S., speaking of which the U.S. at almost 25 million infections in total. And we have here 5 countries that have over 3 million cases, and also 10 countries with far over 2 million infections. And with that, the total accumulated case load stands at 96 million now, with over 526,000 new infections reported in just a day.
Right, so and against that backdrop, vaccine nationalism, I understand, is fueling quite a bit of criticism.
That's right, Sunny. The World Health Organization's chief had some harsh words regarding the distribution process of vaccines, saying it is not fair for young and healthy people in wealthy nations to get vaccinated before vulnerable in poor nations. So let's take a listen.
I need to be blunt. The world is on the brink of a catastrophic moral failure. And the price of this failure will be paid with lives and livelihoods in the world's poorest countries.
Now, on a separate note, the WHO itself was criticized by a panel of experts that's investigating the origins of COVID-19 in Wuhan. The review panel said in an interim report on Monday, the WHO took too long to declare the situation an international emergency, while also claiming Chinese authorities should have implemented public health measures in a more forceful manner. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk. Right, meanwhile, the pandemic has fueled quite a bit of social conflict, which has been aggravated by prolonged restrictions and public fatigue. We have details in this following report.
1월 20일 오전 8시에 중국 우한시 신종 코로나 바이러스 감염증 해외 유입 확진 환자를 확인하였습니다.
가급적 자택에 머물며 최대한 외출과 이동을 자제하고
The COVID-19 pandemic has led to a wave of social unrest amid the growing hardships triggered by this unprecedented health crisis. As the pandemic dragged on, many people were confined indoors, even working from home, while children also attended virtual classes amid school closures. The lengthy period of time spent at home has also led to the deepening of family conflicts. An increase in parenting stress and other sources of tension within the household have led to higher divorce rates around the world. The number of couples who seek counseling is also on the rise here in Korea over conflicts stemming from parenting responsibilities and financial struggles.
자가격리라던가 재택근무라던가 이제 계약연기로 인한 양육 공백이 이제 생기다 보니까 사실 누군가에게는 이 가사노동이 과중될 수밖에 없는 상황이거든요. 그래서 이러한 역할 갈등, 디스트레스가 이제 기존에 잠재되어 있던 가족 문제랑 부딪히면서 이제 심해지면 가족폭력까지도 가는 경우가 급증을 하고 있어요.
So how can we resolve such family conflicts?
나랑 가족원 사이의 공간이라던가 좀 관계적 부분에 적정 거리를 유지하는 것들이 좀 도움이 될 수 있다. 뭐 우울감이라던가 압박감이라던가 이런 스트레스로 인한 상담, 그리고 그 외에도 양육 고충으로 인한 상담, 이런 상담들이 가능하니까요. 센터로 전화 주시면은 저희가 상담이 가능하고.
Friction is also building between neighbors who live in condominiums, with indoor activities leading to a growing number of noise complaints. According to data, the number of noise complaints filed in Korea last year jumped over 60% compared to 2019.
슬리퍼를 착용하거나 아이들이 활동하는 공간에는 소음 저감용 매트를 설치하면 좋을 것 같고요. 악기를 연주할 경우에는 상대 세대와 연주하는 시간을 조율하는 것도 하나의 방법이 될 수 있겠고요. 층간소음으로 인해 과도하게 항의를 하거나 천장을 치는 행동, 그리고 상대 세대의 문을 발로 차는 등 감정적인 대응은 오히려 서로에게 좋지 못한 결과를 가져올 수 있습니다.
With mundane disputes over noise, sometimes escalating into serious conflict between neighbors, the Korean government has even set up a mediation body to settle these matters. Bubbling social tensions have also spilled out into the legal arena, with more lawsuits and complaints being filed in 2020 compared to years earlier.
코로나19 이 대유행이라고 하는 상황이 너무나 급작스럽게 왔고 사회적으로 대비가 안 된 상태에서 왔기 때문에 여러 가지 혼란들이 있는 것 같습니다. 근데 이제 이게 장기화되면서 어려움들이 쌓이고.
These schisms are emerging in all corners of our society, whether it be our homes, workplaces, and schools where our children spend their days. With the pandemic showing no signs of abating anytime soon, communication and understanding is key to relieve friction and tackle the challenges of COVID-19 together as one society.
Up next, we are poised to join the regular briefing on COVID-19 here in Korea for this Tuesday. And while we wait for that to start, let's take another look at the extension of social distancing guidelines in the country until the 31st of January. The restriction on gatherings for social purposes has been maintained. Accordingly, social gatherings of 5 or more people, indoors and outdoors, are banned across the nation. Now, this ban has been in place in the metropolitan region since late December, but has since been expanded to include the entire country. The exception to this ban includes those who live together as registered in their official documents. Also, an exception to the restriction on gatherings is that relates to business as well as weddings and funerals. I understand the briefing is about to start. We'll probably come back to you afterwards with a summary. I've just heard the briefing has yet to start, so I will continue with this. The ban on social gatherings is an exception when it comes to weddings and funerals, where the cap on attendance stands at 49 or fewer in the metropolitan region and 99 or fewer outside the Greater Seoul area. Meanwhile, restaurants and cafes are allowed to accommodate in-house patrons until 9 in the evening, and after that, they can only offer takeout and delivery services. Owners are also required to limit their capacity at 50%. Also, there is a time limit of 1 hour for groups between 2 and 4 people choosing to have a drink or dessert at these places. Now, these guidelines also apply to restaurants and cafes at winter sports facilities. The briefing is about to start now. We'll come back to you afterwards.
First of all, we have Mr. Lee Sang-won with the explanation on the briefing today. Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of January 19th, we have 351 new local infections and 35 new imported cases. The total caseload now stands at We have 386 new cases today, and currently we have 12,364 patients in quarantine, and we have 335 people with severe or critical conditions. And we had 19 additional fatalities, and the accumulated death toll now stands at 1,283. I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now look at our major updates of domestic infections by region. First of all, in the metropolitan area, in Seoul's Songpa-gu district, in relation to the correctional facility, we identified 2 additional cases, and now the total caseload stands at 1,203. And in Seoul's Eunpyeong-gu district, we have a hospital number 3, and we also identified the first index case on the 16th of this month, and we have 13 additional cases, raising the total to 14. And in Gyeonggi-do Province, Anyang City, Suwon City, in relation to a welfare facility there, after we identified the first index case, we have 9 more cases respectively at these 2 facilities, and we have a total of 20 to date. And in Gyeonggi-do Province, Seongnam City, in relation to a traditional marketplace, we identified the first index case on the 5th of this month. We have 19 additional patients being confirmed, and in total, we have 20 patients being confirmed to date. And in Gyeonggi-do Province, Yangju City, in relation to a meat processing factory, after the 15th of January, we have 10 additional cases being confirmed. In total, we have 100 cases being confirmed to date. And in Gyeonggi-do Province, Yongin City, in relation to a church, after the 16th of January, we have identified 7 additional patients, and in total, we have 216 cases being reported to date. In Honam district, in relation to a farm in Jeonnam Province, we also have the first index case being identified earlier this month. We have 5 additional cases, and in total, we have 6 cases to date. And in Gyeongbuk Province, in relation to a bank in Pohang City, we identified the first index case on the 13th of January, and we identified 11 additional cases, and in total, we have 18 confirmed cases to date. And as for other detailed information for other cluster infections, please make your inquiry to the spokesperson office after the briefing. First of all, let us look at the outbreak trend for the past week. During the week number 3 of 2021, we have seen 3,822 cases on a weekly basis, and this is a drop by about 1,500 from the week before, and a drop by 25%. And it is the largest drop since lately. And we have seen that as for nursing hospitals and at long-term care centers, at other virus vulnerable facilities, we have seen a major decrease in the number of infections. And in the previous week, we had about 580 cases. However, this week we have seen a drop of 48%. Meanwhile, however, despite such downward trend, the quarantine authorities would like to note that these figures could also become a signal, a misleading signal for the public to become complacent. We need to remember that right now we are going through the weather of winter, which means that we also could see an increase of the spreading of respiratory disease viruses, and we also have high risks of influx of the foreign variants as well. Right now, we are seeing major decrease in the number of the cluster infections. However, we are seeing an upward trend in the outbreaks and cluster infections stemming from contact with previous confirmed cases. So at any time, we could have a possibility of an individual case infection leading to a massive outbreak. Today, last week, we also mentioned that out of the regulations of the WHO, they have released a new statement on the new variant of the virus. And last week, they have carried out an emergency meeting, and they also dealt with the new variant of the virus, saying that the situation is very risky at the moment. And as for the impacts of these new variants, the one stemming from the UK, they say that it does not have an impact on the severity of the cases. However, it has a high transmissibility. And in relation to a variant from Denmark, we have confirmed that the virus does not spread further to human beings. And the WHO also carried out laboratory experiments, and they advised that countries intensify monitoring against the new variants, and they also recommended these countries to share the related information with the rest of the world. And the Republic of Korea will also take part in such a role in intensifying our analysis of our samples as a responsible member of the global community. Moreover, we would also like to say that as we report continued spread of the new variant, we are going to intensify our quarantine measures along our borders. Up until now, the quarantine authorities have also carried out measures and monitoring for the new variant stemming from UK and South Africa. And to this end, we have been mandating all of the foreign entrants to submit a PCR negative document. And after coming into the country, we carried out the PCR testings once, and before they are released from self-quarantine, they will be mandated to get tested again. And starting from the 18th, which is yesterday, we also have reduced the length of the necessary testings for these foreign entrants from previous 3 days to 1 day to intensify our quarantine measures. Moreover, we are also trying to contain the new variant influx by extending the flight ban from UK until the 28th of January. And also we have been extending these measures to all of the foreign entrants from South Africa as well and Brazil as well. Last but not least, we have seen also starting on the previous day, we have been seeing a delay in a person who had to be admitted to the hospital for emergency surgery. And we would like to, first of all, apologize for such a case. This person was under self-quarantine. However, due to COVID-19, we already have these scheme to enable these people who are self-quarantined to go through emergency situations like surgeries. And in order for us not to repeat such a case, we will make sure that these detailed information will be shared to the local governments. Right now, we are at a crossroad, and we are seeing mixed expectations for the hopeful future and also concerns. And the quarantine authorities cannot be complacent. We will continue to stay vigilant going forward.
기자님들 질문에 답변 드리는 시간 갖겠습니다. 사전 질문 하나와
Right, that was Lee Sang-won with Tuesday's afternoon briefing. So, Anna, he began with details regarding the decline in domestic transmissions today.
Right, although we do see continuous cluster infections breaking out and also cases transmitted from earlier infections, the third week of this month looks pretty positive because 29% of infections, the number of infections was down by around 29% from the previous week, which would be the second week of January. So that is a good sign, but Yi mentioned that this should not give false impressions to the public because we are still in the winter season and infections can still break out, especially as these days, as I mentioned earlier, that there's been a trend of infections among smaller groups, for instance, among families or friends and colleagues. And the official also mentioned the new COVID-19 variants from abroad, as the World Health Organization said that the situation regarding those variants variants is very risky. And he also did mention that the new variants do not seem to have a higher severity when it comes to COVID-19 symptoms, but they do spread faster, which is why Korea will also cooperate in the analysis regarding those variants as well.
All right, well, that's good to know. All right, so thank you for that. We'll see you again tomorrow.
See you tomorrow.
OECD 국가 중에서도 손꼽히는 방역 모범 국가가 된 것은 우리 국민들이 만들어낸 누구도 깎아내릴 수 없는 소중한 성과입니다. 언제든 발생할 수 있는 새로운 감염병에 대비해 신속하고 투명한 공조 체계를 구축해야 할 것입니다.
Today, we take a look at the pandemic's impact on global diplomacy, where efforts to contain COVID-19 took center stage at virtually all online interactions among global leaders last year. I'm visiting Professor An Jun-sung from Yonsei University. Welcome to the program, Professor An.
Thank you.
And joining us virtually is Professor Lee Hoon-sang, also from Yonsei University. Welcome, Professor Lee.
Thank you.
Meanwhile, our Foreign Ministry correspondent Yoon Jung-min is with us from the News Center here at Arirang TV. Hello, Jung-min.
Hello, Sunny. Thanks for having me.
Right. We'll start with you, Professor An. Over the past year, there has been much interest in Korea's COVID-19 containment efforts, with global leaders reaching out to President Moon Jae-in. How would you assess Korea's standing in the international arena amid this pandemic?
Yeah, I mean, it's correct that the South Korea's global standing has been significantly improved during the last year following the pandemic. Like last November, President Moon Jae-in had a telephone conversation with the U.S. President-elect Joe Biden, right? And it's reported that during their conversation, Joe Biden said, both countries had the first reported case of COVID-19 on the same day last year, and he paid great respect to the great government measure has been taken by South Korean government. Also, he added that he'd like to have face-to-face bilateral summit meeting sometime soon. Also, the 2 days earlier, November 10th last year, and President Moon Jae-in had a telephone conversation with the UK Prime Minister Boris Johnson, right? And then also it is reported that Boris Johnson said that South Korea become a good example of a successful, COVID-19 response case. Also, he liked to close cooperate with the South Korea government in vaccine development, right? So you see that, and also he invited, President Moon Jae-in to the upcoming G7 summit meeting in June, right? So one of the guests as the G7. I think that's the good example of the increase the global standing of the South Korea.
Right. And before we delve into the G7 upcoming summit in June, Jung-min, do tell us a bit about the actual diplomatic gains in light of Korea's relative success in tackling the pandemic.
Well, of course, Sunny. So I want to talk a little bit about this non-contact diplomacy, as Professor An just mentioned. If you remember, last November, South Korean President Moon Jae-in held phone talks with U.S. President-elect Joe Biden. And of course, their major concerns were, one of their major concerns were the fight against the COVID-19. And Biden's transition team actually said the President-elect praised Moon for his leadership on COVID-19. And the two leaders also have agreed to work together on fighting against the pandemic and probably stimulating a global economic recovery. And like Professor An mentioned, Moon also met UK's Prime Minister Boris Johnson. He held phone calls with the UK's Prime Minister, and during which Johnson said South Korea's K-quarantine is a good model for the world. And as we know, it has been 1 year since the outbreak of the pandemic, and South Korea is one of the countries that have been hit hard by the outbreak. Well, but I think it took prompt measures, and it brought down numbers through this thanks to this 3T system, which is test, trace, and treatment. And not just that South Korea has been actually sharing the knowledge with the global community. It has been holding press briefings for foreign media to share the knowledge and using diplomatic channels to solve the problem together.
Right. Professor Lee, keeping in mind what Changmin has just said, what aspect of Korea's COVID-19 response received the most credit and what meaning does such recognition hold?
So obviously, Korea's approach with 3T test tracing and treatment are actually one of the hallmark of the Korea's approach. Especially I would highlight especially the approach of the very fast availability of the testing and tracing capacity. But also it stems from Korea's history of learning a lesson from the MERS outbreak. And Korea was already in a very high alertness since MERS outbreak in 2015. And when COVID-19 pandemic actually came around, Korea actually had a very swift response with a very bold measure. So the kind of a very swift action early in the COVID-19 pandemic was actually what made Korea very successful. But also one of the very keenest aspect that Korea was actually noticed globally was Korea Korea went through all the controlling of this COVID-19 pandemic without closing the border and without a very draconian lockdown of the cities. With all this, and especially also the cooperation of Korean citizens was one of the spur aspect of the Korea's response. So all of that actually are actually very noticed very much by global community.
Right, we have been fortunate enough to avoid a lockdown, Professor Lee. Changmin, as you mentioned, Korea has indeed sought to share its strategy with its counterparts. What then have been some of the achievements made through collaboration with its global partners?
Well, Sunny, South Korea has been contributing to ensure vaccines for lower-income countries through COVAX AMC. It's a WHO program to help those countries secure vaccines, and South Korea is contributing, offering $10 million to the program. And the WHO says it's going to benefit more than 90 countries, including North Korea. And I think this is also in line with what President Moon has said at the UN General Assembly last year. He really stressed the importance of equitable access to coronavirus vaccines. And just like Professor Lee has just mentioned, South Korea was able to and has been able to curb the first wave of the pandemic outbreak without completely having to close the borders. It has been actually working with other countries to allow this fast-track entry system for business people. And now it has the system with a program with 6 countries, including China and Japan, though Japan recently announced it's suspending the program because they are concerned about the possible inflow of this mutated COVID-19 variant.
Right, that is true. Now, Professor An, Korea, like you mentioned earlier, has been invited to the G7 summit over in the UK this coming June. First of all, what meaning does this invitation hold?
Well, actually, that's a good example of the improve the international standing of South Korea, right? So, but however, you could see that situation here, it's not that simple actually. The idea about including Korea actually is that also the still active President, U.S. President Donald Trump tried to add Russia to the G7, make it bigger community, but didn't work out because the German and the country was kind of disagreeing with it. But however, the idea about UK, the government take a very cautious approach, I guess. Then they try to come with two factors to consider to adding possibly new member to the current G7 system, right? One was that have to be democratic political system, also have the technology development. So 3 guests, Korea, India, and Australia, comes to be democratic country with a highly developed technological development, right? So that's the factors. However, there's other factor, I guess. There's Japan issue because the Japan is only one Asian country in the G7 as of today, right? And it was 2008. I think Japanese government was invited Korean government first time as guest, right? But however, in principle, the G7 rules, you have to try to be a new member. You have to get consensus approval. Means that if the Japanese government veto on the addition of any new member, then there was some challenge. So I guess there's kind of perhaps a diplomatic challenge in the coming years if the South Korean government really intend to try to get in G7, and then the other member will say yes, we'll still deal with the Japanese government about the issue, right?
I see. But then just out of curiosity, Professor An, what are your personal thoughts about the prospects of such, the existence of a G10 summit then?
I think it's highly likely these days because that as of today, Japan is the only one Asian country in the member. And you see that the EU perspective, they have an EU, right? European perspective, EU, and there's a US side. Also, they want to expand their, they want to expand their influences, perhaps, maybe much bigger market also. India is a huge market. Also, Australia, they want to cover. Also, Japan, and also including Japan, Korea, and India is really big much bigger international community. Also, sending signal to the U.S. and kind of try to get balance. Asia is kind of in the middle of Europe and Russia. I guess they're trying to get middle ground. I think that's how I would say it.
Right. Chungmin, meanwhile, this past Monday, President Moon hosted his New Year's press conference. What was shared with regard to Korea's diplomatic strategy for this region and beyond, especially in light of the incoming Biden administration over in the U.S.?
Right, Sunny. So yesterday, we did hear some strong messages from President Moon on his will to achieve the Korean peace process. Well, to give you a wrap-up, Moon said he hopes North Korean leader Kim Jong-un will visit Seoul someday as the two sides have agreed, adding that he's willing to meet the North Korean leader anytime, anywhere. And he also said Kim Jong-un is still determined to achieve peace and denuclearization, and North Korea wants his security to be assured. Moon added he would make great efforts to improve inter-Korean ties because he has not much time left until his term ends. His remarks did signal that Seoul will play an important mediating role between North Korea and the U.S. for the resumption of dialogue. Well, on North Korea and U.S. talks, Moon said Biden is known to prefer a bottom-up approach rather than a top-down strategy, which would likely include more working-level talks. And finally, he also touched upon the need to improve South Korea-Japan ties, which would be important ahead of the incoming Biden administration because Biden might want to push for reconciliation between Seoul and Tokyo to bolster their trilateral cooperation with Washington. And I think those were some major takeaways from yesterday's press conference, I guess.
Right. Professor An, keeping in mind what Chungmin had just said, what should Seoul seek to focus on with regard to matters on the Korean Peninsula as the new U.S. administration takes office?
Yeah, I think that the President Moon Jae-in had made it during the New Year's press conference perhaps some issue that both U.S. and Korean government had agreed on two principles. First was the multilateralism and then alliance, right? I guess in terms of multilateralism, I guess we need to kind of reconfirm make stronger relations with perhaps China. Also, we know that some current situation we have some issue with the Japanese government. I think that might be an issue in the coming year if we going back to multilateral approach to the North Korean issue. Also about the alliance issue, I guess that we know that there is so much military negotiation with the bilateral military negotiations between U.S. and Korean militaries, right? I think that's one of the beginning point, and then we're not sure how they approach it, but still we can do it because that the military issue is a bigger issue to the U.S. I guess that we can deal with it. Or I guess also that we're not clear whether the Biden administration will follow the Obama's foreign policy yet. So you have to see evidence about at least 6 months to get everything. His appointment was done. So we'll have to see. But until then, we need to work on the multilateralism side. Also, in terms of improving the alliance with U.S. government, we will try to streamline the negotiation with the U.S. government with other issues.
Right. Meanwhile, Professor Lee, what do you propose with regard to regional collaboration here in Northeast Asia against infectious diseases post-pandemic?
Obviously, as we are learning from the COVID-19 pandemic, this kind of large-scale pandemics are not preventable by just one country. Even though we have COVID-19 this time, it can come back anytime again, as we experienced with SARS and MERS, and also many other avian influenza and many other outbreaks. So it is really important to establish regional cooperation mechanisms not just to aid other countries, but also to protect this region and global community together. And also especially, as I said again, East Asia and Asia Pacific area had been quite prone to many of the outbreak since 2000, starting with the SARS, avian influenza, and many of others. And also, there are many of those are coming from the animals. Actually, with the increasing contact between the human population and animal population, and also with the large-scale livestock industry. All these are actually increasing the pressure for new kinds of emerging diseases to come around. So that's why actually we really need to work together, not just with some of the nearby countries, but in the Northeast Asian region, and also including Asian Pacific region, with many of the countries in Southeast Asia, and also with the United States and other countries as well.
Right. Professor Lee, speaking about those joint efforts, what are your thoughts on vaccine diplomacy, including that by neighboring China?
For now, actually, for Korea, Korea, I think, will be mostly relying on some of the vaccines that have been developed in UK and the United States. Especially Korea have some of the contract with AstraZeneca, but some additional aspect is actually some of the Korean vaccine manufacturers, such as SK Biologics, actually has a CDMO, contract development and manufacturing organization arrangement. So actually, recently, SK Biologics actually increased their manufacturing capacity from 150 million doses of vaccine to 500 million doses of vaccine, which means at some point, Korea will be having more than enough vaccine, more than what it can cover Korean population. So at that point, actually, Korea will be strategically a very important country for the global community, especially for developing countries. Especially because AstraZeneca vaccine is one of the type of vaccine that does not need very cold chain capacity, and it can be stored in the relatively less freezing temperature. So which means it will be eventually very important vaccine for many of the developing countries. So I think in that regard, Korea has a lot to contribute, and also Korea actually has been contributing to the COVAX facility, and Korea is actually working very closely with such a global vaccine provisional arrangement. So in that regard, Korea, it will be very important for Korea to be very actively engaged in the global provision of vaccine.
Right, and speaking about Korea's contributions, Chungmin, what's on the diplomatic agenda for the country for this particular year?
Well, Sunny, first I think it's worth mentioning, it's worth noticing the G7 summit. Of course, we've discussed this on this program today, but the UK is going to hold a G7 summit in June, and South Korea is invited as a guest, and also invited are Australia and India, so it rather looks like a G10. So, and some people say this is because South Korea's tackling against COVID-19 has enhanced and raised its global stature, and it's also likely to be Biden's debut on global stage as the U.S. president. And there are many diplomatic events slated for this year, but I think I want to highlight the P4G summit, which is going to be held in Seoul this year. South Korea has been very active on tackling climate change and achieve carbon neutrality, and this is a part of reason that it has been pushing for its ambitious Green New Deal and Digital New Deal projects, and Seoul really hopes to confirm global solidarity at the P4G summit this year.
Right, that is good to know. Professor An, while the pandemic remains a concern for many countries, of course, including Korea, what are some other variables amid Korea's diplomatic agenda for the year, as disclosed by Chungmin?
Well, I guess the major factor will be that is like I think the international cooperation in development, more rather speedy development and the fair distribution of the vaccine, COVID-19 vaccine in the coming year. So you know that the vaccine is around the corner, here, and then still I think that U.S. and some other European countries have some problem with their supply chain here, although they had a sufficient number of the vaccine in their country, but they have some other domestic problem also. But I guess that's time, or how to distribute, that's the issue, right? And then the internationally, also domestically, that's the issue. Or the South Korean government, also other countries will have to pay attention in the coming year. Right? That's a factor. How to distribute it, right? That's the issue.
Right. Professor Lee, what do you believe is Korea's role in boosting global collaboration against infectious diseases that look to threaten international stability, like the one we're currently experiencing?
To start with, I think Korea's unique role is in the area of vaccine. Actually, right now, actually, it is a situation where every country is just for themselves. And I think it will be really important for Korea, even though actually at this moment, Korea there had been a little bit of a struggle to secure vaccine within Korea. First of all, we have to secure vaccine for our citizens first. But eventually, at some point, Korea will be able to secure vaccine for our own citizens. Then with our own vaccine manufacturing capacity, and also with Korea's unique positioning in the global community, Korea can advocate for global protection of the whole global populations, not only the developed country, but also developing countries as well. But also, Korea had been very innovative in its approach and very swift in its actions. Korea actually raised its response level even before WHO declared the public health emergency of international concern. So in that regard, Korea can also work with many of the partner countries so that not to work on the response of each of individual countries, but to really work on global response efforts together. Actually, before President Trump, actually, it was United States right after the Ebola, which initiated global health security agenda, and Korea was one of the earliest country to respond to the call and join the initiative, which somewhat lost its fit during the President Trump initiative. But I think Korea can be strong advocate for more of the multilateral effort in the global community. So in that regard, I think Korea can really act proactively for global health security related global diplomatic policy issues.
Right. Professor Han, earlier on the program, our consul spoke about the criticism by the global health body with regard to vaccine nationalism. What are your thoughts on vaccine nationalism, and how do you propose that we seek to deal with this problem?
I guess that's the problem with our capitalistic system, right? So money comes first. That's the issue, because that I think that it's not about the fairness issue, right, rather than the economic issue, right? So I guess that it's not about the domestic issue. It's more like international things. Means that G7 or perhaps OECD or the United Nations have to deal with it because the international perspective, right? So it's more like a fairness issue about the human right. So it should come first. Life comes first, and the money issue, right? That's the things concerned. Also, in my add that in terms of the vaccine diplomacy, we kind of not talking about much about North Korean situation. But although they say they have no reported case in North Korea, and I'm afraid that there are many cases there. Obviously, right. So I guess that's one of the things. We might not overlook that North Korean issue also about the vaccine distribution. Right? I think that's the factor you have to consider.
Right.
Not to forget about North Korean vaccine case. Right.
Right, because we do share a peninsula. So.
Yeah.
Professor Lee, we are poised to start a vaccination campaign next month. What do you suppose will ensure the ideal environment for a productive vaccine campaign next month?
So first of all, please, I would like to recommend everybody to please watch for any kind of fake news about any kind of vaccine scares. Even though the COVID-19 vaccine had been developed incredibly fast speed. The security and the safety had been quite secured in high regard. So first of all, we have to have a high trust in the vaccine and the system. And also, it will be really important to respect the prioritization. So we have to secure the vaccine for the first responders, healthcare personnel, but also for elderlies and some of the priority groups, because those people for healthcare personnel will be the first people who will be exposed to any kind of a COVID infection, and also people who are above 65 years old or 50 years old will be those people who are likely to have a severe situations with the COVID-19 infections. So please be patient, and I think we will eventually get there with the high level of vaccination coverage, more than 60 to 70%. So let's wait and let's work together, and let's be patient in terms of how we progress with the situations.
Right. All right, Professor Lee, thank you very much for your insights. Professor An here in the studio, thank you for being with us today. And Chongmin over at the News Center, thank you for your time as well.
Thank you.
Right, cluster infections are on a decline, but those arising from individual contact with infected people within domestic and office settings remain high. So do seek to wash your hands, wear your face mask, and watch your distance. Thank you for watching.